Hi, I'm Charles Feruzza with Mindful Movement, and if you're watching this video, you've probably been feeling some back pain for the last couple of weeks, months, or even years. You might be having some stiffness in your lower back, some sharp shooting pains, or even some electrical or burning symptoms going down the back of your legs. So today, I want to show you the 3 best exercises that I've found that can help relieve some of your symptoms. Now, before we get into those, I want to qualify what those different exercises are going to be. So the 3 major categories of movement dysfunction that we need to address with low back pain are: first, your breathing mechanics; second, your hip mobility; and third, your thoracic or upper back mobility. Getting all of these things to move a little bit better is going to take some of the pressure off your lower back and relieve the pain and symptoms that you're feeling. The first thing we're going to do is a breathing exercise. All you need is a mat or a carpet, something soft to lay on. You're going to lay on your back, and you're going to bring your knees up towards your armpits. You don't want your knees to go straight to your chest. You want them to pull out to the side a little bit. So laying on your back, hug your knees, one on each hand, pull up and out to your armpits. Tuck your chin under. You want your lower back to be flat. You're going to breathe in through your nose and out through your mouth. Try not to breathe into your chest. I recommend doing 10 breaths, so let's go. Ready? You might feel that as you're breathing, you can get deeper breaths in and deeper breaths out. That's a good thing. You might also feel that as you're exhaling, your knees get closer to your chest. Keep hugging them tight, and you're going to get more out of the exercise. The next thing you're going to do is a hip mobility exercise, and these are called seated knee drop-ins. So looking at it from the side, you're going to sit with your hands behind you, posting your body up and your knees wider than your hips. So looking straight on, what you're going to do is let your knee drop into the midline. Hold that position for 3, 2, 1. People are going to have the tendency to let their pelvis rock forward like this. This isn't what you're looking for. You want to keep your sits bones grounded on the ground, so both of your cheeks grounded on the ground. Let your knee fall into the side without letting it pop up, and hold. So let's go. 1, 2, 3, and back out. 1, 2, 3, and back out. I recommend doing 5 of these on each leg. You can do 2 or 3 sets if you feel like they're doing you a lot of good. You can feel a little bit of a stretch on the outside of your hip, but you're probably going to feel some stuff in your groin or up towards the inside of your hip on the inside of your thigh. You want to make sure you're doing both sides and try to see if there's a difference. So again, it's a 3-second hold. 1, 2, 3. 1, 2, 3. Last one. 1, 2, 3. Good. And you should feel like your knees are able to drop closer to the ground each time you do it. The last thing you're going to do is your thoracic mobility exercise or your upper back exercise. And what you're going to do is lay on your side, bring your knees up towards your chest and keep them stacked. Put your hand on your knee and your top hand on your chest. All you're going to do is keep your knees stacked and rotate your top shoulder blade down towards the ground. And rotate back. You're going to do 10 or 15 on each side, and you should feel like you can get a little further each time. If you have any pain in your lower back while you're doing this, you're going to want to bring your knees closer to your chest, hug them a little tighter. And if you have any pain in your neck, make sure you're not trying to look over your shoulder. You only look up at the sky and let your shoulder blade and your upper back do the work. So let's get 10 of these. You want to make sure that you do these evenly on both sides. You should feel like you can open up a little bit more with each one. You may have a little bit of difference from the right side to the left side, and that's okay. Whichever side has less range of motion or feels like it's a little stiffer, you might want to do a few extra sets on that side. I want to remind you, if you have been dealing with some lower back issues, that's okay. These exercises will probably help with your symptoms, but you're going to want to get checked out by a physician or a physical therapist so that you can get some specific treatment and exercises for what you have going on. If you have any questions, please feel free to email me at charles@mindfulmovementptnj.com or give me a call at 973-542-4068. I look forward to hearing from you. Thanks.